All right. I think everyone has probably joined us at this point. I want to welcome everyone here this evening. My name is Barb Junker, and I'm from the nursing department here at Hope College. We're delighted tonight to have Dr. Sherri Sutton-Johnson here to speak with us and share some of her work and research experiences with us. I want to quick give you an overview of how the evening is going to go. I'm going to introduce Dr. Sutton-Johnson, and then she'll share with us her presentation. Following that, we have a student panel. So we'll have some students introduce themselves and ask some questions for Dr. Sutton-Johnson. And after that, we'll have a question and answer period where those of you watching from home can pose a question and we will answer those for you as well. To go ahead and get started, I'd like to introduce Dr. Sherri Sutton-Johnson. She currently serves as the Education Unit Director for the Florida Board of Nursing. She's served in this capacity since 2012. Prior to accepting the promotion, she was employed as a nursing education consultant for the board for 4 years. Dr. Sutton-Johnson has been fortunate to enjoy a lengthy and worthwhile nursing career, as she is nearing 29 years as a licensed professional nurse with experience in various healthcare settings and 30 years employment with the state of Florida. She received her Bachelor of Science in Nursing and Master of Science in Nursing degrees from Florida State University. And she received her Doctor of Public Health degree with a concentration in health education and behavioral health from Florida A&M University's College of Pharmacy and Pharmaceutical Sciences, Institute of Public Health. Dr. Sutton-Johnson's research focuses include end-of-life decisions, population health, and cultural practices related to life-altering disease processes, caregiving, and related social determinants of health. Her research focused on the lived experience of Black student caregivers at historically Black colleges and universities. Dr. Sutton-Johnson has been married to her husband, Antonio, for 25 years and has 2 children, a son, Antonio II, who goes by AJ, and a daughter, Ayana. She is active in civic and community organizations and resides in Chattahoochee, Florida. Welcome, Dr. Sutton-Johnson.
Thank you. I'm so delighted to be with you all this evening, and I very much appreciate the invitation. I know many of you, when you heard Chattahoochee, you're wondering, where is that? You may be familiar with our capital city, Tallahassee, Florida. We've made the news quite a bit recently related to the COVID infections, but Chattahoochee is the home place of the first state mental institution in the state of Florida. You may have heard of the movie One Flew Over the Cuckoo's Nest and the movie Chattahoochee. Out of those movies, policies and regulations were implemented to assist people with mental health issues. And it is quite a conversation piece when I introduce myself and say to someone that I'm from Chattahoochee, they automatically assume that I'm a former patient. So it's very comical and a great way to start a conversation. So tonight, I just wanted to share a bit of information on how COVID-19 has impacted nursing regulation and nursing education. And so my point of reference will be the state of Florida, as I'm employed with the state of Florida, but there may be some similarities in your state in relation to regulations in education. So I just wanted to share my presentation, and we'll begin. And hopefully after the presentation and our question and answer sections, you will be able to discuss the impact of COVID-19 on nursing education and how that is personally and professionally impacting you and your decisions regarding your nursing profession, discuss a general plan for research proposal development, and create a professional plan for career maintenance within the limits of the law in relation to your Nurse Practice Act. So you will hear me all through the evening emphasize how important it is to be very familiar with your particular state's Nurse Practice Act and your scope of practice. You may have the opportunity to work in various states, and you will be responsible as a licensee to and be accountable for your scope of practice and your actions related to that state-specific laws and rules and regulations. So I just wanted to begin with this slide. So beginning with COVID, COVID has certainly changed everyone's lives. It's changed our way of thinking. It's changed our daily activities. It's changed how we matriculate at school, how we function at our jobs. And so nothing could be done in the state of Florida in relation to our healthcare professions until there had been a declaration of an emergency by our governor. He issued several executive orders, beginning with the declaration of emergency, and he empowered our state surgeon general to take any necessary steps through the Department of Health to ensure the safety and well-being of our residents and our visitors. So if you can see here, it says that the executive order declared a state of emergency in Florida. And typically these executive and emergency orders that are issued by the governor and the state surgeon general are effective for a period of 60 days unless they are extended. And so I just wanted you to see what happened during this time. It authorized practitioners in other states to provide assistance to healthcare, to hospitals, in nursing and other healthcare professions. It authorized practitioners to provide care through telehealth, telemedicine, restricted access to certain businesses for a period of 30 to 60 days. It also authorized the Department of Health and our division, the Office of Medical Quality Assurance, which licenses over 200 healthcare professionals, to extend renewal deadlines to ensure that there would be adequate staffing in facilities and hospitals to meet the needs of patients who would be infected with COVID. It also empowered us to reactivate nurses' licenses who had become inactive for whatever reason. In the state of Florida, you can place your license in an inactive status. You still pay an inactivity fee every 2 years. You're still responsible for completing continuing education, but you maintain that inactive status and it can be reactivated at your choosing. So this authorized healthcare professionals and nurses who had inactive licenses, who had retired licenses that were unencumbered, meaning there was no discipline imposed against their license, to be reactivated to assist with the healthcare needs in our state. And so while I'm speaking about discipline, and we'll get to this later on in the presentation, as I mentioned, it is so important for you to be aware of your scope of practice once you are a licensed nurse. Every other month, we conduct our official board meetings where our executive board members meet and they make a decision on nurses' licenses regarding discipline. You would not believe how many nurses violate our Nurse Practice Act. They do things and they say, I wasn't aware that I wasn't supposed to do that, like videotaping patients' genitals and posting them on the website and sharing confidential information. And so it is imperative that you as a licensee, once you become licensed, you do everything in your power to maintain that license. And so as far as nursing education, there was a restriction almost immediately on clinical facilities and hospitals where nursing students, nursing assisted training students were conducting their clinical experiences. When they were not allowed to conduct those or complete those in person, there were no options for them, as our statute does not regulate distance education programs. I know many states allow hybrid programs and online curriculum. Florida's Nurse Practice Act does not allow that. So unless there is a legislative modification authorizing that, there was nothing that the Board of Nursing could do. And we understood the anxieties and the stress that this was placing on the nursing programs, the faculty and the students. But until there was a legislative modification or an executive or emergency order authorizing instructional options, nothing could be done. On March 21st, Our state surgeon general, Dr. Rivkees, issued an emergency order that authorized the use of simulation in nursing programs. Our nursing programs are authorized to use up to 50% simulation in conjunction with clinical training. Programs are not mandated to do so, but they have the ability to utilize simulation. At this point, he authorized 100% simulation for all clinical training hours and live remote video conferencing for classroom components of the courses to assist students so that they could continue to progress through their programs. And this was to protect the faculty, to protect students, to protect patients that were already in the hospitals. And so the initial emergency order was issued on March 21st, and it was effective for 60 days. And it has been extended through various emergency and executive orders from the governor and Dr. Rivkees. We are currently approaching a deadline, November 3rd, and nursing faculty are frantic because they were hoping they would be able to continue with this option until the end of the semester. So we are hopeful that we will receive an extension from the executive office of the governor to allow this. We typically don't receive extensions until the day of the deadline and sometimes a few days afterwards. Also, for our nursing assistant training programs, those students were allowed to complete the certification exam without completing the demonstrations, the skills demonstration component, the clinical component of that examination to assist in rapidly testing students to get competent professionals out in the workforce. Now, simulation is a great tool if you are a well-established university or college program that has access to resources and funds. But we, in the state of Florida currently, we regulate 430, as of today, 430 registered nurse and practical nursing programs, pre-licensure programs. Many of those programs are privately owned. They don't receive funding from the state. And they do not have the resources. They do not have simulation labs. They do not have additional funds to assist with online education learning programs. So it has placed quite a burden on those programs and those students, as you can imagine. NCLEX testing and testing for the nursing assistant certification examination was halted for a while. There had to be barriers placed in the testing centers and assurance that there would be adequate social distancing to ensure everyone's safety until the end of April or May. Testing started to resume, and every week testing centers are added to accommodate students, but that placed some programs on a standstill. And due to the restrictions of the clinical facilities, some programs were not able to enroll or admit as many students for the fall semester as they would normally because they could not accommodate those students to assure safety for all. So it has placed quite a burden on all healthcare professionals, particularly in the state of Florida. There are almost 500,000 licensed nurses in the state of Florida. And so we receive daily inquiries regarding people who would like to reactivate their licenses. Some have voluntarily relinquished their license, and that means they gave their licenses up. They may have done that for personal reasons. Some of them did so to avoid criminal charges, as they did violate the Nurse Practice Act. However, voluntary relinquishment in the state of Florida is considered discipline on your license. So I just want you to be very mindful that whatever you do, I know you're young, you want to enjoy life, but there are some offenses that may occur, misdemeanors, and some felonies that are disqualifiers of licensure in the state of Florida. So back in 2010, a bill was passed that if you committed a crime under a specific statute that was you committed a crime, a drug charge or Medicaid or public assistance fraud, that you were ineligible for licensure for 15 years. The following year, during that next legislative session, a glitch bill was implemented that added a tier system to those disqualifications. So you may have committed an offense. Every applicant undergoes a criminal background check. If one of your offenses is one of those that could be a disqualifier of licensure, if you've had to be incarcerated or you serve probation, when your probationary period ends, you are still disqualified from license for a period of 5, 10, up to 15 years. So it's very important to realize if there's ever discipline imposed against your license, and it may be the same in the state of Michigan, in the state of Florida, discipline will always be linked to your license. Your license can be verified on our website, and you will always see where it says discipline linked to the license. It'll say yes. You can click on that hyperlink, and it may even show that that disciplinary action was resolved. You may have had to pay a fine or administrative costs, so you may have had to complete continuing education courses, or whatever the case may be. There's still discipline linked to your license that you will have to explain wherever you go, whatever interview, if you apply for employment, it may be a means for disqualification of employment due to the discipline. And so I thought it'd just be cool to share some of our licensure statistics. I don't have statistics from our fiscal year report this year, but last year there are almost 354,000 registered nurses licensed in the state of Florida, over 35,000 APRNs, almost 82,000 LPNs, almost 185,000 nursing assistant training programs. And the numbers related to the RN, LPN, and CNA training programs have increased a bit. Like I said, as of today, there are 430 pre-licensure programs in the state of Florida. We do not regulate post-licensure graduate programs, but we do regulate those pre-licensure RN practical nursing programs and nursing assistant training programs. And so responsibilities, once you become a licensed professional, you are required and expected to maintain competency through continuing education. If it's not a requirement to maintain your license, just for professional and personal edification. Our world is ever changing. Healthcare, nursing is ever evolving. And so there are times where you will need to refresh on procedures and techniques to ensure that you are relevant and that your patient care is evidence-based. Florida is one of the few states that requires mandatory continuing education because there is no practice requirement. In many states, you have to practice a specific number of hours. You have to practice as a nurse and maintain your active license in order to renew your license. In Florida, that is not the case. You are required to complete 24 to 26 continuing education courses every 2 years to maintain your license. Please be familiar with your current laws, rules, regulations that govern the practice of nursing. Yes, the Board of Nursing in your state is a resource, but you as the licensee are responsible for your actions related to your scope of practice. You're responsible for keeping and staying abreast of those laws and regulations that govern your practice. Remember that laws and rules are subject to change, and it is your responsibility to be aware of those changes. Seek out information that might affect your scope of practice. During every legislative session, there may be a major bill, a major piece of legislation that impacts nursing education and nursing regulation. There may be a minimal bill or a train bill, as they call it, where they throw a lot of things in, and if you're not careful, it may impact nursing. For example, back in 2016, a law was passed, and it just threw a lot of things into the legislative language, and there was one piece that was specific to nursing. Nursing at that time in the state of Florida was the only profession that was going to be required to complete a human trafficking CE course for license renewal. It did not become effective until 2019, but it impacted our scope of practice. It would have impacted your ability to renew your license. So it's very important that you are familiar with your scope of practice at each level of nursing. This may be your initial introduction to nursing education. And I hope that you continue, that you pursue advanced degrees and advanced education. You're always learning. You're a lifelong learner as a nurse and a human being. So it's very important to know your scope of practice and be familiar with things that may impact your license and your ability to practice. If you're ever unsure of something, we learned in nursing school years ago, when in doubt, don't. If you're not sure about something, don't do it. Ask for verification. There's no harm in asking and seeking for additional assistance. We have nurse consultants. I supervise 3 nurse consultants. We have a very small unit. The Board of Nursing is one of the largest units, one of the largest boards in medical quality assurance for the Department of Health. But we have a very small education unit. We review applications for internationally educated nurses. We review program applications. We serve as liaisons and consultants to our board members and answer very basic general scope of practice and licensure questions. If there's anything that requires an interpretation, we're not attorneys, and we recommend and strongly encourage interested persons to seek private counsel. But don't be afraid to reach out to your Board of Nursing. We're there to be of assistance. We're not going to harm you. We want everyone to be successful, but if you have violated one of the laws and rules, there's not much information we can provide to you other than to seek guidance from legal counsel in the event that you would need to take that route. And here is my contact information. And I know you may have very specific questions about COVID, nursing regulations, and other topics. So I just wanted to provide my contact information if you wanted to just reach out as a resource. If you had questions on how to reach out to other boards of nursing to gather information to help you along your nursing education journey. The Board of Nursing of Florida joined the Nurse Licensure Compact in 2018. I know Michigan has pending legislation. You've not joined the compact yet. There are currently 34 states in the compact. So if you're licensed and you're issued a multi-state license, you have the privilege to practice in any of the states that are members of the compact, unless there is a violation and that privilege is revoked. So if you are interested in relocating to Florida and you're issued a multi-state license, if you want to travel all over the country, you'll travel to compact member states, you have the privilege to practice. You do not have to contact the Board of Nursing to say, hey, I'm here. You have your license. It can be verified through an electronic system. However, if you do relocate to a state that is not a member of the compact, you will be required to obtain a single state license there. But I will entertain any questions that you have at this time, or you may want to wait until the panel discussion to ask your questions. I can't hear you.
Thank you so much, Dr. Sutton-Johnson. I think while we wait for questions to start to come into the Q&A, we'll start with the student panelists, and we'll have the students introduce themselves and share some of the questions that they have for you as well. So I guess I'll let Kathleen go first. Go ahead, Kathleen.
Hi, my name is Kathleen Sineska. I'm a senior at Hope College, and I am from the Florida area. I'm from Naples, Florida. So it's really cool to see another Florida woman.
What made you decide to, on Hope College?
I received a really good scholarship, I believe, and their sciences are really good, and they are like invested in research, and I have like an interest in research. I'm currently in research right now. So yeah, that's what kind of like intrigued me to go into Hope.
Okay, so you're gonna stay in that area, or are you gonna venture back south?
I'm going to definitely leave Michigan, maybe Chicago, or go back to Florida.
Oh, okay, all right.
Yes.
I'm Emma West. I'm a junior, and I'm originally from Northwest Indiana.
Okay.
Hi, my name is Darian Davis. I'm also a junior at Hope, and I am from Bloomfield Hills, Michigan.
Oh, okay.
Hello, and my name's Adam, and I'm from Holland, Michigan.
Okay. Nice to meet you all. I can't hear anything.
Sorry, Kathleen, if you want to go ahead with your questions, you can.
Okay. So I have a few questions, but I'm gonna just start with this one. I wrote my question.
Okay.
Okay. I said higher education is becoming more inclusive for students of color, and we're overcoming systemic barriers to our education. So basically, my question is, how would you suggest for instructors like here and at other PWIs, how would you suggest that they create a program that's more inclusive for students of color? Because I feel like the goal is always to have minorities like be represented in a program, but it's like once you get there, how do you create a program that's inclusive, that supports the student academically and socially and stuff like that, and so that they get to the finish line, because the goal is to graduate and to be competent nurses.
Right.
So like, how do you help them in that middle period from beginning to the end?
Okay. Thank you for that question. So first of all, I think it's very important to understand the culture, different cultural barriers, understanding that in previous years, STEM professions and nursing and medical professions weren't always the professions that minorities promoted. I don't know if there was enough information, and there were not many professionals, many professors, many instructors that looked like us and that were minorities that actually attracted students. So you have to understand the barriers first in order to understand how to communicate effectively and attract students so that you will have a more diverse program. When I started at Florida State University, it was in the early 90s. And at that time, there were, I want to say 51 of us in our cohort. Out of those 51, there were 3 Black students, including myself, a Haitian student, and 2 Hispanic or Latino. And so it was very difficult. And at times, it seemed as though we were invisible because the instructors would focus on other students. If we had a question, it may not have been answered effectively. We may have received a brief answer. There was no expounding on the information, and at times derogatory statements were made to make us feel inferior, as though we didn't belong there. And so you have to have a sense of empowerment. There were a few minority professors there, but at that time, they didn't take the time to embrace us and to make us feel welcome and to promote the profession of nursing to minorities, to help us understand that we were just as valuable as anyone else. You have to understand the cultural barriers. You have to understand how to effectively communicate and attract. You have to be welcoming. And once you have a diverse group, you have to design a curriculum that involves courses that embraces cultural differences, different aspects of nursing, to understand that when you go out into the world, you're not going to be in this bubble, that you are going to be caring for people from every ethnic background, every culture. You're going to have to be able to prepare students for rejection. You know, there were times where some of our classmates had to be assigned another patient because, and we had 2 men in our class as well. So we had a very diverse group. And at times, you know, there had to be additional assignments because we had a woman refuse to have a male nurse care for her. We had a couple of patients refuse to have Black students and Black nurses care for them. So you have to understand cultural differences, what students are going to be facing, and then how to effectively attract students of diverse backgrounds. And once you have them there, what you can do to increase the retention. You have to open up the lines of communication. Sometimes the conversations are not going to be comfortable, and they don't need to be, because it's real life, it's reality. Life is not always comfortable. You're going to be pushed outside of your comfort zone, and that's called growth. That's what you want, but that prepares you personally and professionally. So you have to figure out a way to first effectively communicate, attract people in your program, and then figure out what needs to be done. Figure out what those students' needs are. Have them come to you and tell them what your expectations are, and then ask what the expectations are as a nursing professional in order to design and grow your program and increase the diversity and the acceptance.
Thank you.
Mm-hmm. You said you had other questions. Was that the only one?
Oh, do I continue or do you move on?
I don't know if you were going to do it round robin or how are you going to do it?
If you want to ask another one, you can, Kathleen, and then we can go.
Okay, so this is more like of a research question because I have that research background. So because COVID has hit a lot of like minority communities like heavily, I was just like wondering like how can, as like a nurse that I'm going to be in the future, how can I promote like Black people in the community or even minorities to participate in clinical trials that they're going to have for COVID and stuff like that? Because I know that because of like the Tuskegee experiment thing and all these other things that they've done on Black people, we don't feel comfortable to participate in these trials. But I feel like it's very important that we are a part of these trials because they can tell like how it will affect our people because of our comorbidities and all these other different things. So how do you think,
the medical issues?
Yeah. So how do you think as a nurse I could better influence my future patients? Like, you know what, like I know like these things have happened, but like there are like rules and regulations that are implemented now that can like protect you from those things happening that happened before. Like how can I go about that?
Well, you have to sort of lead by example, and you have to build a trusting rapport in the community. And you touched on something that's a very sensitive issue. I don't know if it is to the degree in other minority circles, but in the African American experience, as soon as someone hears clinical study, they immediately revert back to the PE experiment. And there is a general mistrust of the government. There is a general mistrust of the healthcare system related to that. Some people may disagree with that, but it is a huge barrier and it is a huge issue. And you just have to build a trusting relationship. You have to educate. You have to learn, as I stated before, you know, there are cultural barriers, there are educational barriers, there are health literacy barriers. Everyone doesn't understand things on the same level. So you have to meet people where they are. You have to accept the fact that people are fearful of being harmed because they hear experiment. And for years, experiment was kind of a dirty word because you heard of, or you think of mad scientists and all these experiments. So you have to really educate and break things down to the level that people can understand. People really don't care that there are laws and rules in effect to protect your human rights, because they see so much of their laws and rules in place, but so many of our rules are, our rights are violated, even with those laws. Under the umbrella of those laws, rights are violated. And so you have to just be sensitive to people's feelings, be sensitive to their fears, and educate. You have to educate, and you have to be visible, walk the walk and talk the talk, so to speak. You can't just throw them out to the wolves. They've got to see you actually buying into what you're trying to sell them.
Okay. Thank you.
Mm-hmm.
Thank you. Emma, if you'd like to go next, you can ask a question.
Yeah, I have kind of a twofold question for you. But before
Okay.
I ask that, I did just want to encourage the viewers that there's a question and answer icon down at the bottom of your screen. And if you have any questions for Dr. Sutton-Johnson, then you can type those in there and they'll be fielded and we can kind of present those to her for you as well. But my question more is in regards to telehealth. And I was wondering, with COVID, you mentioned the rise in the use of this and kind of how you see that rise affecting healthcare in the future. And then also, do you see like the use of telehealth as a benefit to minority groups or another thing that could drive a wedge or promote disparity in a way?
Yeah, I think that, we were moving towards telehealth in many healthcare systems had embraced and adopted telehealth and telemedicine before the COVID-19 crisis, but it increased the necessity to provide healthcare this way. And it's here to stay. I mean, it's easy access, and it's really effective. I think people are more comfortable in their own settings, and they're able to relate to their healthcare professional better because it's a more informal setting and they feel more at ease. I think it is an advantage and as well as a disadvantage to some minorities. There's still a technology divide. Some folks do not have internet access. We've seen that with the school systems, that there has been a cry out for additional funds and for folks to donate computers and tablets and devices because people just don't have the resources. So those that are able to communicate with their physicians and their healthcare providers through telehealth, it's a marvelous thing. It's the wave of the future. It's very beneficial, but those who still lack the access, don't have adequate finances to maintain their utilities, don't have access to a computer, don't have access to transportation. Some folks could go to the public library and use a computer and have their appointments there on the phone. Some people still don't have cell phones, people don't have transportation. So yes, it's wonderful. Yes, it's advantageous for those who have the resources, but it's still increasing health disparities and the technology divide in marginalized populations.
Thank you.
Mm-hmm.
Great. I think Darian, you were going to go next with a question.
Yes, first I just want to thank Dr. Sutton-Johnson so much for focusing on what it means for us as nursing students to have a diverse educational setting that recognizes the importance of different cultures and bringing down those barriers, because I believe it's really important to help support students of color and of different backgrounds. My question specifically for you is about COVID-19 and how media coverage really exposed health disparities that pre-existed COVID-19, specifically showing how minority populations showed higher case numbers throughout the pandemic. And I was wondering, in your opinion, with your background on public health, How can we make changes with this spotlight in the educational setting in order to best care for those vulnerable populations?
Well, we have to do our best to really just increase the awareness and education. I've come across people who still at this point, who have lost family members, who have lost close friends, who have lost coworkers. They still think that it's not real. It's just this flu, and if I catch it, it'll be okay. And I almost want to catch it because then I'll know that it is real, that it exists. And so we have just, as public health professionals, we have to continue to spread the word about hand hygiene, protecting ourselves, wearing masks. If we are exposed, isolating ourselves, taking care of ourselves. Yes, the COVID crisis shed a light on minorities and the increased health disparities in relation to the biomedical issues. Minorities are at higher risk for developing the chronic health conditions, diabetes, hypertension, and are less likely to seek medical attention for some of the reasons that were mentioned earlier. There's a general mistrust of the healthcare system. They don't want to seek assistance, and many do not until they're having an acute illness and they are to the point where they have to seek emergency assistance. So education is the key, but again, there has to be a level of trust in the community. You have to be visible. Even now, you know, we can't physically embrace people the way we want to. We can't gather in groups, but we can have these Zoom meetings. We can do conference calls. We can do drive-by educational fairs and have information on the table. We can have bags of gloves, bags of masks, and how to use those, and when to use, and how to use hand sanitizer, and how to properly wash your hands. So it all boils down to visibility, providing education, and developing a trusting relationship with the community. That is key.
Thank you so much.
You're welcome.
All right, I think we'll move to Adam.
Yeah, so thank you so much, Dr. Sutton-Johnson, for doing this. So my question actually comes back to Kashleen's question about, you were talking about being an example, but for the majority,
Right.
how do we bring up, kind of like you were talking about those research studies, how would you recommend that? Because you were talking about, Kathleen, for you, just being able to lead by example. I think, yeah, just how would you address it as a majority in a population that sees it as potentially dangerous?
Well, you have to, as majority, be receptive to other ideas and opinions. Be mindful of your feelings and opinions, and understand that just because you have not had an experience, it doesn't mean that it didn't occur. And when people are sharing experiences, negative or positive, in the classroom, outside of the classroom, and trying to come up with things to make improvements, just have to be willing to exchange ideas, not dismiss something negative that's occurred because it has not happened to you, and just be willing to go the extra mile to make improvements. If you see, you've heard the expression, if you see something, do something. If you hear something, do something. You have to be willing to take that extra step to make change happen. We all want to make change happen. We all say, you know, we want to be the change that happens in the world, but you have to take the extra step. It takes work. And like I mentioned before, it's not always comfortable. It's not always going to feel good. And progress is typically coupled with controversy. And so there has to be an open line of communication and a willingness to make change. You can meet every Wednesday to talk about change, but unless you make a step to actually do something, you have to move, you have to make something happen, implement something. If it doesn't work, okay, go back, tweak it until it does work, but you have to put in that extra time and that extra effort to make it work. So I hope I answered your question.
Thank you.
You're welcome.
I just want to remind everyone that we do have a question and answer box below. So if you'd like to submit questions below, that would be great. And I'll let Kathleen, I think you had one more question for Dr. Sutton-Johnson, is that right?
Sorry, yeah. I just have to pull it up. I just wanted to hear from you. I think you kind of answered it, but like just to reiterate it again, like what does like an inclusive program look like to you? Because I feel like I asked this question and I think that it's just very important to me because I feel like at PWIs, you throw in like 2 students of color and then it's called inclusion, but like as a student of color who's in a program where as a senior class, it's only like basically 2 of me and another girl, just because they're Black, we don't hang out together. So I never feel inclusion within my nursing program, to be honest. So like, I just wanted to know, like you who's been through the nursing program in the time that and in seeing other people and your colleagues, what do you think an inclusive program actually is, from the number of students that are represented to even the material that's shared to even just like how there's like underlying like understanding. Like let's, for example, if like a teacher were to explain something and then related to skiing, like I have no background in skiing, so I can never really relate and understand the topic that is being taught. So like, what does an inclusive program look like to you?
Yeah, and I don't necessarily think inclusion is just restricted to, you know, skin color and culture. I think inclusion means, to me, and this is just my personal view, accepting others where they are, accepting others' ideas and experiences. You have to build on other experiences to kind of grow as a person. So I had the experience of attending a PWI undergraduate and then in the master's program at Florida State. And then I attended Florida A&M, which is a historically Black college and university in Florida. And so in that setting, students of color are the majority. So you may have a couple of white students, or we had students from Greece, we had students from Mexico, but it was a smaller university. There were smaller classes, and so you had better connection with those students because they were right there in your face, and you found that you had very similar backgrounds. And it may have been because of some of the negative experiences that you shared, you had very similar backgrounds and experiences, and so that kind of tied you together. But I think inclusion should be like-mindedness. You're all, you're in nursing school, you're bettering yourself, you're seeking a profession, you're caring for people, and you want to be respected, and you're viewed as someone with integrity. And so when you're like-minded and you're coming together, you're experiencing the highs and lows of nursing school. You know, I can't imagine now how difficult it has been in nursing school during this crisis. It's stressful enough to be in nursing school. You know, you had to worry about care plans and learning all your meds and caring for your patients, but now you're having this additional stressor of you're not able to get out in the clinical facility. You're not able to have that hands-on experience with your patients. The faculty is stressed because even though online learning is very common now, it's still different. It's still a different connection than it is when you're in the classroom. So inclusion can mean a lot of things. It can mean different things to different people. So I think it's just based on where you are at the time in your life. It just depends on what you're looking for and what you're seeking. If you're wanting to be accepted by your peers, so you're wanting to dress like them, to act like them, to talk like them, to walk like them, then that's your definition of inclusion. So it depends on where you are professionally, where you are personally, what you're seeking and what expectations you have kind of defines what inclusion is. So an inclusive class would be people of different cultures, different backgrounds, but you have similar expectations, or you wouldn't be in a nursing program. You wouldn't be seeking this profession, that you're going to be caring for others and providing care and being able to be a great resource for your community and encouraging one another to do well. In my class, in my doctoral program, I was one of the oldest students in the class. I was 52. And whereas the younger students could get on these devices and get on these laptops and pull things up and do this and do that and do all these cool PowerPoint presentations and spreadsheets and all these graphics, I couldn't do that. But they'd say, come on, Miss Sherri, I'll show you how to do it. We'll do this. You know, they'd share their techniques, and then I would share some of my techniques, my study habits and different things. So that is a part of inclusion, that you're being accepted at your level. People are accepting you where you are. Even though you may have some shortcomings, you're accepted. You can help someone, they can help you. There's an equal exchange.
Thank you.
You're welcome.
Great. We have some questions starting to come into the question and answer forum. And
Okay.
I think there's one here from one of our nursing instructors from
All right.
Dr. Ann Zeidema that I thought would be good for perhaps both Kathleen and Dr. Sutton-Johnson to respond to.
Okay.
If you'd like, I can read it out loud.
If you would, please.
Sure. The question states, as a nursing instructor, I certainly make every effort to implement an all-inclusive classroom. I'm saddened when I hear stories about students of color feeling so isolated and alone and like they just don't fit in. Do students of color appreciate individualized attention from faculty in a one-on-one setting to ensure the student feels included, or do students just want to blend in?
Yeah. Yes. The students of color don't necessarily want preferential treatment, but they would want to be treated like anyone else. I can remember I was struggling in, I want to say it was a med surge course, health assessment. And one of the instructors came over to me and she says, you look like you're having some trouble. And she says, I'll carve out some time over the weekend if you like, and you can come to my office and we can talk about the issues that you're having and what I can do to help you. And that made all the difference in the world to me. Now, she may have made that same offer to other students, but it made me feel so very special, and it empowered me, and it made me feel like someone does care. I'm not invisible, and what I do in this class does matter. And so, yes, individual attention, if it's requested, is very much appreciated. And like I said, not preferential treatment, but if someone else receives, is able to schedule 25, 30 minutes of your time, of your office hours, it should be available to all the students. If you answer a question in class, you shouldn't be blown off. There are some things, there are certain words that people say, there are some phrases. I had an instructor say to me once, there was something we were doing in the classroom, and this goes back to cultural sensitivity. And she said, oh, that was so easy. And she says, even a monkey could do that. And that was very offensive, very offensive. So it's very important that you understand some things that you say, people, they don't mean to be hurtful and say things that are offensive, but you have to be cognizant of cultural differences and negative connotations that are associated with certain things, certain images that you portray, certain things, certain pictures that you show, certain graphics and certain phrases that you use may be offensive, and that makes students of color feel like they're just not valued. That if you said that to me, you really don't think that I'm a person of value. And it can really impact morale. It can really impact the students' productivity in the classroom, because they don't feel like they can come to you as a human being and say, that was very hurtful. You may not have meant it to be offensive, but that was hurtful. So it's very important to, just like I said, establish a trustful relationship. And if you see that there's a student that may be shying away, that's not answering questions in the classroom, that's not participating, and that is not fulfilling or living up to the their fullest potential, you may want to pull them aside and say, what's going on? There may be some personal issues. It may not even be related to the classroom, but it is impacting their ability to perform well in the classroom.
Yeah, I can definitely agree. Just having a teacher ask me like how I'm doing, or you look like you're struggling, and like having that personal one-to-one makes me feel like you actually care about my education. And also like in the times that we are in now, with all the like civil unrest and all the shootings that are going on, like I personally have only had one instructor ask me like how I'm doing with just the Breonna Taylor and all these different things that are going on, because like that impacts us so much. It's because it's like we're seeing people that look like me die everywhere, but then you're expecting me to be at clinicals, take care of other people. And it's just like, and then like my community around me being at a PWI, as a Black student, we take on their stressors as well, because we're all trying to navigate in a world that is full of white people, and we come from diverse backgrounds, and we're not used to like having to deal with all these like problems and stuff. So it's like I'm your student in the classroom, but then I also have all these things that like affect me, and having someone just to be like, you know what, I'll sit and help you with this, or I'll take the time out to do that, just makes you feel like, dang, like maybe they do care about like who I am as well, because it's easy to learn and be in my books and stuff like that, but it's also important to just, we're holistic. We care about holistic care. So I just want a holistic person to just think of me holistically. Yeah.
The next question we have from the viewers is, what do you think the long-term impacts of COVID-19 will be on nursing and healthcare as a whole?
Well, I think it's too soon to tell right now, but I can tell you from nurses calling, I've had several nurses just call to de-stress. They're licensed in the state of Florida, but they volunteered in other states, New York and other states that had very high cases of COVID, and just the constant stress of death and dying, and them not being able to care for the patients, to touch their patients, to have the contact they would like to have with those patients, seeing those patients pass away and they're there without any of their family members, and the emotional impact it has on the nurses. And it's burning nurses and other healthcare professionals out. They're stressed. They are developing conditions similar to PTSD. There are several nurses who have, they're developing depression and committing suicide. And so it's impacting the way that they're caring for their patients, but it's also impacting the way they're caring for themselves. It's a sense of hopelessness and helplessness in many cases. And it's just too soon to tell how it's really going to impact the healthcare profession and nursing professionals, because we're here in it. It's a very present challenge right now. And it's going to take some time to reflect to really focus on how it's really impacted nurses and other first responders and essential workers who've been on the front lines and their family members. We've seen it in the state of Florida in our nursing homes, that many of the residents in the nursing homes, because they're not able to have that human contact, that visit from their family members who are their caregivers, even though they have professional caregivers in those long-term care facilities, they have family members who were deemed their caregivers before they were placed in those facilities, who they depended on to just be present, be able to touch them, to feed them, to care for them. And that's adding an extra burden to the healthcare professionals in those facilities, because they're having to take on so many roles, but have to be mindful that they have to protect themselves because they're going home. They don't want to infect and expose their loved ones. And so it's just really at times, based on the conversations that I've had with nurses, too much to bear. I've had advanced practice nurses call me and break down and cry because of the things that they've seen, and just so much death and illness in these hospitals. And so it's going to take a long time for our nurses and others to heal and to be at a place where they can just make sense of what's happening. Things are happening so fast, so quickly. There's not enough resources, not enough equipment, and they're really doing the best that they can. And so right now, I don't know what the long-term effects will be. I'm sure there'll be mental health issues, depression, some chronic health issues that will develop in relation to sleepless nights and long hours and poor nutrition, and just not having an outlet where they can de-stress. They don't have time to de-stress and just deal with what is actually going on, because they have to be there and be very present to take care of their patients.
Thank you for answering that. The next question we have is in regards to your research, and it's having recently completed your doctoral work, how do you see your research moving forward in your current role?
Well, it's been quite interesting. And the reason I selected to study Black students in HBCUs is really from personal experiences. I had a couple of classmates, and one in particular that was caring for her mother who was diagnosed with Pick's disease. And so that's a rare form of dementia, and she was given a 5-year survival rate, and her mother lived with her for 10 years after she was diagnosed. And her mother passed away during our spring 2016 semester. And prior to that, she had been very dedicated. I mean, she studied. She was our classmate that whatever question you asked, whatever topic was addressed, she could answer it. She could go to a website and provide information. And then after she no longer had the responsibility of caring for her mother, she still, and to this day, has not been able to return to a sense of normalcy. Her sleep pattern is still disturbed because she wakes up in the middle of the night. She was waking up every 2 hours or so to check on her mother, to make sure she was breathing, to change her, to turn her. And she's just not been able to refocus. And by profession, she's a physical therapist. She's not been able to return to her practice. She's withdrawn her classes. She's not been able to complete the doctoral program, and it's affected other students. I've had other classmates that had to take on the responsibility of caregiving for others, and there's no resource for them really. In any of the schools, there's no survey or no questionnaire that asks at the point of intake that, you know, if there are additional responsibilities that may impact your studies. There's no, unless you share the information, there's no support group for folks who are students and who are caregivers and who may be full-time employees. And so I want to further my studies to really focus on what exactly happens, what's happening 3, 5, 10 years down the line after the caregiver experience has ended. Are you able to return to your normal activities? Are you able to care for yourself? Have you found that by caring for others and taking on these additional responsibilities and dealing with discrimination and dealing with a lot of the life stressors that we have and we're forced to deal with, how has that impacted you? Some folks develop hypertension, some folks develop depression, anxiety disorders because they don't know how to reintroduce themselves into a sense of normalcy. For years, they've taken on this responsibility and their identity has just become that person's caregiver. You've assumed the responsibility of making sure that person goes to their appointments and they have their medications administered at a certain time. They have their meals and you've essentially neglected yourself. And so there's no tool I've seen that's been developed or addressed related to students at historically Black colleges and universities to deal with that, to help them along. So the goal, as Kathleen said, you're in a program, the goal when you start your program is you want to complete your program. And so there are instances that students begin the program, they may already be serving as a caregiver, or they may have to take on the responsibility of caregiving during their matriculation. And so it may impact them to the point where they cannot continue with their educational pursuits because of the added pressures that relate to the caregiving responsibility. So I want to focus I really want to open a community center, and I wanted to focus on the whole person. What can we do to help you? If we can provide adult daycare services to help kind of allay some of your anxieties. If you have a test, if you have to attend a class, you don't have to worry about rushing home to make sure your loved one is okay, is safe. You know, they're in a safe environment. We're there. We'll take care of that person until you're finished with your exam, or if you just need time to de-stress and to meditate and just have some me time, to eat a wholesome meal and just not think about some of the responsibilities. I want to be able to deal with and address all those issues with caregivers. And in my particular area, I live in a very rural area where some people have to travel 30, 40 miles just to see a physician, or they may have to pay someone to take them to see a doctor. There are not many health clinics and facilities that help with mental health issues outside of the state hospital that's here. So I want to be able to address what's going on after the caregiver experience has ended. How can we help you resume some sense of normalcy? How can we help you be introduced back into the place where you need to be in order to be a productive citizen?
We received another question from the chat that asked,
Okay.
how can we as nursing students and future nurses encourage and support each other, especially during the COVID-19 pandemic? And to provide a little bit of perspective of our program here at Hope, I personally noticed that there sometimes can be this competitive nature amongst nursing students. And I've been personally challenged to no longer discuss or share my grades with other students, because at that point we become more of numbers that we want to compare ourselves with. And it's that challenge of seeing like how we can interact with each other, because others notice if we're supporting each other or not as a team
Right.
on this campus. And how has your perspective as both a student and working with like education and regulation, like what in your opinion can we do in order to continue supporting each other during this time?
Well, you have to communicate with each other, and you have to figure out what's going on. If you you have to identify your strengths and weaknesses, and by communicating with each other, you know, you may have a strength in one area, and you may be able to assist one of your members of your cohort. You have to communicate what's going on, figure out what's going on. If you see someone is struggling or not particularly having a good day, whatever you can do to give a kind word, a word of encouragement, just a sense of belonging helps improve morale, and it helps with productivity. You may not necessarily have to share your grades, but you may do study groups. And I know it's very difficult to do that now in the age of COVID, but there has to be an open line of communication. If you don't know what's going on, you can't provide assistance, you can't provide encouragement and support. So we found in the educational associations on each level, we have an education association for deans and directors of practical nursing programs, associate degree in nursing programs, Bachelor of Science in nursing programs. And so they meet on a regular basis, and meeting more now through Zoom and go-to webinars, conference calls, but just the sharing and exchanging of ideas. And they come together on a regular basis now, and they just share their experiences teaching in the age of COVID and what their students are experiencing, and just sharing those experiences and knowing that you are not alone, that you have similar experiences. You don't know which way to turn at times, and that's okay to feel kind of lost, to feel overwhelmed. That's normal. And just sharing those ideas, sharing those experiences seems to help.
Thank you so much for that perspective. We really appreciate that as students here.
You're welcome.
Adam, I believe you have an additional question you would like to ask.
Yeah, I have one question for you. It's kind of two parts, but so being in simulation and doing our online stuff, I have a question for you related to that. So what would you say to students who feel that the pandemic will affect their future care that they give to students? And also, has Florida established any additional like nursing mentorships or any other avenues to assist and empower nursing students coming out of a simulation environment?
I'm not aware of any specifically in the state of Florida. However, those associations that I referenced may have individual agendas to assist students. I am aware, and some of your nursing faculty may be aware of the National Council of State Boards of Nursing. You may hear us refer to that as NCSBN, in conjunction with many nursing professional associations, are in support of academic practice partnerships. Many of the institutions in Florida have not bought into this partnership because it's an issue with liability and making sure that students are safe. But there are some nursing programs and facilities that have partnered, whereas while you are students, even though you're not authorized as a student to enter a clinical facility, if these institutions enter into an agreement with a clinical facility or a hospital to actually employ a student, and they are gaining nursing experience, assisting in general areas of nursing, not necessarily exposed to COVID patients, but it is lessening the burden of the nurses in the actual hospitals, that whereas they're able to care for the COVID patients, as well as the students are obtaining nursing experience, and they're also obtaining clinical credit while they are employed. And so that may be the wave of the future. Who knows what's going to happen? Simulation is a great tool, although I've mentioned before that some programs may not have every opportunity to fully utilize simulation, as they just don't have the resources to have full out state-of-the-art simulation labs and the high fidelity mannequins. And regardless of how much simulation is conducted, even though we have mannequins that simulate grunts and moans and diseases and disorders, it still does not compare to the actual human connection when you're providing that hands-on care to a patient. And so whereas it is an advantage because you are obtaining some real life experience and you're conducting these scenario-based experiences, working with simulation is still, I think, putting you at a disadvantage because it's not allowing for the unexpected. In the simulation labs, things are somewhat controlled, but when you're getting out in the real world and you're dealing with real people, who knows what will happen. But it is a great tool to utilize to ensure everyone's safety. And anything, almost anything can be used as a simulated experience. If you're simulating how to hand wash, you have to take advantage of any experience right now. Any experience simulation practice in a lab is so helpful when you are ready to go out, and it is safe again to go out and have that human contact. But that hands-on experience with real live patients is second to none. But simulation is here to stay, and it is a great tool in conjunction with clinical and didactic components of your courses to ensure that you are receiving every aspect of nursing education to prepare you to be competent nurses. And as you're prepared to test and you take the NCLEX, it's testing minimal competency. And so you are going to be learning on a daily basis once you're on the floor, once you're in the various settings, because nursing is so open now. It's such a great profession because you can do almost anything in nursing. You're going to be learning something on a daily basis, and you're going to be improving on your critical thinking skills, areas of research, how you can do things better. Why did this happen? Why didn't this happen the way I wanted it to happen? And so it's just going to be, who knows what's going to happen after this. So I'm hoping that great ideas and innovative tools are developed to assist students in the event that something like this occurs in the future. We don't know. COVID may not be the last pandemic that we face, so we have to be prepared. So this has been a great learning curve. It's been a bit painful, been a learning and a period of adjustment.
Thank you.
You're welcome.
Thank you. Emma, I believe you had another question.
Yeah, so we had another question come in through the chat.
Okay.
And it states, do you foresee any additional impact of COVID-19 on the existing nursing faculty shortage?
Oh, definitely. And it goes back to we're facing, I know it's been an issue in Florida and probably throughout the country, there is a shortage of qualified nursing faculty. And so when you have that shortage, it impacts the ability to produce competent nursing students, competent nursing professionals. Many of our experienced nurses have reached the age of retirement, and many of them have health issues that impacted their ability to continue to teach in our nursing programs and accompany students in the clinical sites and facilities. And so it's going to have a great impact on nursing faculty. We've had a couple of nursing programs close, smaller programs. They just cannot make accommodations for the different changes and challenges that they're facing in the age of COVID. And so it's definitely impacting the number of nursing professionals that are being, that are graduating and that are being licensed. And it is impacting the number of nursing faculty. Some are just retiring and moving away from the nursing profession. So it's been quite challenging and quite interesting to see how the nursing programs have survived during this period. It's been very challenging for all involved.
Thank you. And then I did have a personal question from
Okay.
specifically. And during your presentation, you mentioned how important it is to stay updated on the legislature.
Mm-hmm.
Do you have any recommendations on how exactly to do that, or resources that us as future nurses could utilize?
Definitely. Ask questions, become involved in your state's professional nursing associations. I don't know if you have a student nursing association there at Hope College, but become very involved. They're usually very politically involved. They have political advisory councils. If you become a member, They keep you abreast on upcoming pending legislation. Our Florida chapter of the American Nurses Association, we have a Florida Nurses Association here. And so every year during our legislative session, there's a week that the Florida Nurses Association has advocacy days. So those are the days that they come into town, they complete CEUs, they meet with local legislators, representatives, senators. They actually have individual meetings. They have the agenda that they want to push forward for the upcoming year. So you have to be very in their faces and very involved with political change. And nurses, we outnumber physicians. Our voices are heard. Our opinions are valued. Our nursing experiences are valued, but we have to be more visible and more involved in the associations and in our community. So you have to ask questions, but definitely get involved with your professional associations. Contact your board of nursing, whatever state you choose to become licensed and work. Always stay on their website. There are always updates. You can subscribe. You can subscribe to our website. We have a Twitter account. We have a Facebook account. We're always updating things on legislation that impacted your profession. Anything that happens that is impacting nursing regulation, nursing education, is on our website. Subscribe to your nursing journals, your quarterly publications to find out what's going on in your area, what's impacting nurses in your area, what's impacting your profession, but be involved. If you're not involved, you don't know what's going on, ask questions. You're always in the know when you ask questions. You may not know what questions to ask, but ask them anyway, but stay involved. That's a plus, stay involved. Once you become a member of your association, once you're licensed, stay involved, subscribe to the nursing journals, complete those CEs that you receive in those journals and those publications, because they are evidence-based, they're current, they're relevant. So you're getting a snapshot of what's going on in the world, even if the CEs that you're completing are not in your specialty, you're getting that knowledge, you're gaining that information, and you are being an involved nurse. Run for office, maybe, or hold an office in one of those associations. We also have an organization called Quinn Council here in Florida. It's quality and unity in nursing. And so the Board of Nursing is a member, but the Association of Nurse Practitioners, Association of Perioperative Nurses, there are various nursing organizations and representatives from universities and colleges of nursing that come together to brainstorm and think of things that will improve the profession of nursing and education, what we can do to protect nurses, increase civility in the workforce. There have been issues with nurses being bullied and being harmed in the workforce. So just coming together, sharing those ideas, figuring out what's going on, what we can do to improve students' transition from education to practice. Those ideas are discussed during those meetings. So you have to be involved in those organizations to know what's actually going on, but definitely get involved with your local representatives and senators so you can have a say as to what will impact nursing education and nursing profession, because we have constituents that have proposed different legislative ideas and different issues that have impacted their nursing programs individually, and it's resulted in the modification of legislation in our Nurse Practice Act. And so your ideas and your voice is very important and it's very needed.
Thank you.
You're welcome.
Thank you so much, Dr. Sutton-Johnson. I think
You're
we have
welcome.
addressed all the questions here. I don't see any that we missed.
Okay.
And we greatly appreciate you taking time out of your schedule to join us tonight and share your insights and experiences. It's been really helpful for me, and I think for all the students as well. And we had about 70 attendees here tonight also joining us. So thank you everyone for tuning in to listen to this presentation. Does anybody have
Thank
any
you
other
again for
remaining
the
questions?
invitation.
Thank you so much. We really appreciate it.
Thank you.
Have a good
I-
evening, everyone. Oh, sorry.
I
Go
just
ahead,
want-
Kathleen.
I just wanted to say thank you so much for doing this. It's amazing to have you as a representation of someone I can look up to and hope to be as knowledgeable as you. So thank you so much. It just means a lot to see someone who looks like me in a higher position, teaching and educating everyone. Yeah.
Well, thank you so much, and I wish you all the best.
Thank you. Good night,
Thank you.
everyone. Have a great evening.
Bye-bye.
Bye.